House lawmakers on Monday finalized a sweeping veterans bill to expand caregiver benefits for elderly and infirm veterans and update medical options for veterans outside the department's healthcare system, sending the legislative package to the White House to become law. The legislation was originally passed by the chamber last month but had to be reapproved this week, after technical changes were added by the Senate last week. The measure now heads to the White House, where President Joe Biden is expected to sign it into law in the coming days. Advocates have lobbied for months for passage of the bill, expected to cost roughly $1 billion over the next decade. They've argued the reforms are needed to catch up with the care demands placed on veterans caregivers, who save taxpayers tens of millions of dollars annually with their around-the-clock personal medical care. We have spent almost 2 years working tirelessly with our coalition partners to ensure a better future for our veterans, caregivers, survivors, and their families, said Elizabeth Dole Foundation CEO Steve Schwab in a statement after passage. Through this life-changing and life-saving legislation, we are one step closer to our vision of an America where veterans and their families thrive. The measure, its full title is the Senator Elizabeth Dole 21st Century Veterans Healthcare and Benefits Improvement Act, features significant improvements to current caregiver support programs within the Department of Veterans Affairs. It would expand access to home-based and community-based services at every VA medical center. Supporters have said that will allow tens of thousands more veterans to receive medical care at home rather than in nursing home institutions, if they choose to do so. The bill would increase the cap for in-home care programs from 65% of nursing home costs to 100%, potentially providing thousands of dollars more a month to eligible families. In some cases, that figure could go even higher if VA officials decide that at-home care is in the best interest of the veterans. The legislation would also create a mental health care grant program for family caregivers in the VA's current program. And the bill closes a loophole to stop veterans from losing their burial benefits if they choose to die in hospice care rather than a VA facility.